I think we were all expecting something a bit different today, Omar. I think with calls for schools to close, one was expecting the minister to come today to say that, there would be a blanket approach and possibly close all schools, especially in Gauteng. But in fact, she came and she outlined the vaccination program for the sector, saying that the sector was, of course, expecting around 300,000 doses that will be administered as of the 23rd of June. So this coming week, we expect this program to run for around 10 to 14 days, and that all support staff as well as teachers in the sector will be vaccinated. Let's take a listen.
We are of view that schools must remain open, and saying so, we are not insensitive to the concerns raised about the rising infections. The position that we want to, which we will be presenting to Cabinet and also to the National Coronavirus Command Center, is that COVID cases must be handled case by case in a differentiated approach, on a province by province, school by school. And therefore, if there is an outbreak, the school must be handled there, and it cannot be nationalized for any other reason. So while there are disruptions in the sector, the majority of our schools remain fairly stable.
So the vaccination starts on Wednesday this week, which is pretty efficient. And I guess all the logistics have to get sorted out immediately, right, Slee?
Certainly so. What we understand is that the vaccines will be delivered to the various provinces between Monday and Tuesday. We understand that teachers must register before getting vaccinated. There's also some conditions as well. So if you've received the flu vaccine in the past 14 days, you cannot be vaccinated. If you've already received the vaccine, you're also going to be able to vaccinate it. But if the vaccine rollout for the teachers is not age dependent, so any teacher of whatever age and all support staff will be able to get that vaccine. But then, of course, if you've received a vaccine, if you have a flu vaccine already, then you won't be able to get the vaccines that are being made available for the education sector. She also did state, of course, that there will be additional doses that are expected later on this week, and that it does seem as though that the vaccine hesitancy within the sector has certainly decreased. At the beginning of the year, we were looking at around 52% of teachers who said that they would not want to get the vaccine once it became available, but that as it stands, around 76% of teachers right now are keen to get the vaccine once it's made available. Let's take a listen.
With the support and guidance from the Department of Health, the vaccination program for DBE will unfold with immediate effect. And we're urging all our teachers to say, and everybody else who's in the sector, to say, let's pull all stops and make sure that we do vaccinate all of us in the sector. Dr. Granville will give more details around the vaccination program. It will start the Wednesday, the 23rd, which is next week, and continue until the 8th of July, when we close our schools. We will be vaccinating all teachers in the PESA, which is where we register our educators, administrative and support staff, irrespective of age. We'll also be vaccinating, this I thought I should raise because it kept on being raised in the morning. We'll be vaccinating even teachers who are school governing body appointed teachers and those employed by independent schools. That's why we also had a meeting with them to make sure that we have a comprehensive program of all the educators in the sector. In total, for the next 10 to 14 days, we plan to have almost 582,000 people in the sector vaccinated.